Hi friends, good evening and welcome to my channel Mugambika Nursing. Friends, we are discussing pediatric nursing questions. Firstly, we completed community health nursing. Next, we started pediatric nursing question. Already we completed part 1 and one set of question we completed. Here we can see the next set of questions from pediatric nursing. Question number 21. Toxoplasmosis is caused by. Options are option A fungus, option B bacteria, option C protozoa, option D it's a viral infection. Correct answer is option C, it's a protozoal infection. Toxoplasmosis is caused by protozoa. This toxoplasmosis is an infectious disease which transmits from mother to fetus, and this can result in severe physical developmental abnormality to the fetus. Toxoplasmosis is coming under torch infection. Torch infection, that is toxoplasmosis T. O means other infection, R means rubella, C means cytomegalovirus, H means herpes simplex. It is this toxoplasmosis is one of the torch syndrome. Okay, it is caused by protozoa. Option C is correct over here. Next question, normal blood glucose level in 1 day old newborn. Question is glucose level in 1 day old newborn. Options 40 to 60 milligram per deciliter, 50 to 80 milligram per deciliter, 50 to 90 milligram per deciliter. Option D 30 to 60 milligram per deciliter. Correct answer is option A 40 to 60 milligram per deciliter. That is the normal blood glucose level in 1 day old newborn is 40 to 60 milligram per deciliter, and it is in newborn older than 1 day, that is 50 to 90 milligram per deciliter. The next question, the mother of a newborn calls a clinic and report to a nurse that while cleaning the umbilical cord, the mother noticed that the cord was moist and discharge was present. The appropriate nursing instruction is. Options are option A, bring the infant to the clinic. Option B, this is a normal occurrence. Option C, monitor the cord for another 24 hours to 48 hours and call the clinic. And option D, all of these. Here in this question, the mother of a newborn, she called to the clinic and reported to the nurse that while she was cleaning the umbilical cord of his baby, the umbilical cord was moist and discharge was present. She noticed the discharge. So while hearing this, what the nursing instructions can give by a nurse? That is the question. So while hearing this, what the nurse can give? She can tell that bring the infant to the clinic. Option A is correct. The symptoms of umbilical cord infections include moistness, oozing, discharge and redness around the umbilical cord. If the symptoms of infection occurs, immediately she should show it to the physician. So, the nurse should instruct her to bring the infant to the clinic. Option A is correct over here. The next question, moral development theory is by. Options are option A, Sigmund Freud, option B, Lawrence Kohlberg, option C, Jane Piaget, option D, Erik Erikson. So, correct answer is option B, Lawrence Kohlberg. The moral development theory is by Lawrence Kohlberg. Option B is the correct answer. Psychosexual development theory is by Sigmund Freud. Option A. Jane Piaget is cognitive development theory is by Jane Piaget, and Erik Erikson is psychosocial development theory is by Erik Erikson. The next question, according to Erik Erikson, theory of psychosocial development, the developmental task obtained by adolescents is. Options are option A, becoming purposeful and directive, option B, establishing intimate bonds of love and friendship, option C, developing sense of identity, option D, fulfilling life goals. According to Erikson theory of psychosocial development, the developmental task obtained by adolescent, that is the question, the developmental task by adolescent is developing sense of identity. Option C is correct. In Erikson, psychosocial developments include infancy, early childhood, late childhood, school age, adolescence, early adulthood, middle adulthood, and late adulthood. These are all the developmental stage by psychosocial development stage by Erikson. In this, the adolescent period is between 12 years to 20 years, and the main psychosocial crisis occurs in adolescence is identity versus role confusion. This is also important question. The main psychosocial crisis occurs in adolescence is identity versus role confusion, and the task obtained by the adolescence is developing sense of identity. Okay, option C is correct. The next question is, a child is learned to use scissors to cut out pictures by the age of. Options are option A 4 years, option B 5 years, option C 6 years, and option D 7 years. The correct answer for this question is option B 5 years. A child is learned by himself or herself to use scissors to cut out pictures by the age of 5 years. 5 years or 60 months. The next question, at which age initially the sign of autism occurs? Options are option A before 1 year, option B before 2 years, option C before 3 years, and last option D before 4 years. So correct answer is option C before 3 years. Autism is one of the neurodevelopmental disorder. It can initially occurs or the signs initially shown before 3 years of age. The next question, and this was one of the previous question, a child can able to tie shoelace by the age of. Options are option A 4 years, option B 5 years, option C 6 years, and option D 7 years. Correct answer is option C 6 years. A child can able to tie shoelace by the age of 6 years. Option C is correct. The next question, trisomy of chromosome number 13 is. Options are option A Klinefelter syndrome, option B Down syndrome, option C Petau's syndrome, and option D none of this. Correct answer is option C Petau's syndrome. Trisomy of chromosome number 13 is known as Petau's syndrome. In Down syndrome, trisomy of chromosome number 21. In Petau's syndrome, trisomy of chromosome number 13. Down syndrome, trisomy of chromosome number 21. And Klinefelter syndrome, first option, that is one extra X chromosome. Boys with one extra X chromosome. Normally 46 chromosome, but in case of Klinefelter syndrome, there is 47 chromosome, that is XY. Okay. And the next question, the size of suction catheter which is used for suctioning of mouth and nose in a newborn baby is. Options are option A 6 in number, option B 12 in number, option C 20 in number, and option D 2 in number. The suction catheter which is used for suctioning of mouth and nose in newborn baby is 6 in number. Option A is correct answer. It is green color. 6 number size is used. That is the suction catheter size. Next question. In following, which hormone is responsible for milk secretion by the alveolar cells? And options, option A oxytocin, option B prolactin, option C estrogen, and option D LH, that is luteinizing hormone. Correct answer is option B prolactin. Prolactin is a hormone which is responsible for milk secretion. Milk secretion is by prolactin, and milk ejection hormone is oxytocin. Okay, prolactin and oxytocin. Prolactin is responsible for milk secretion, and oxytocin, option A, oxytocin is responsible for milk ejection. Okay. That is the next question. Okay, question number 33. Which of the following hormone is mainly responsible for ejection of milk from the glands into the lactiferous sinus and ducts? Is correct answer is oxytocin. Oxytocin, which is helpful for milk ejection, and prolactin, which is helpful for milk secretion. And the next question, Child Labor Act, that is Prohibition and Regulation Act, is in option A 1968, option B 1976, option C 1986, and option D 1996. Child Labor Act, Prohibition and Regulation Act, in option C 1986 is the correct answer. And the next question, Child Marriage Restriction Act. Options, option A 1968, option B 1978, option C 1986, option D 1996. Child Marriage Restriction Act in 1978. Option B is the correct answer. And the very next question, normal blood pressure of a baby of 1 year age is. Options, option A 120 by 80 mmHg, option B 140 by 90 mmHg, option C 100 by 60 mmHg, and option D 60 by 30 mmHg. And the correct answer is option C 100 by 60 mmHg, normal blood pressure of a 1 year age baby. The next question, hepatitis B vaccine is not given if the birth weight of a baby is below dash. And the correct answer is below 3 kg, below 2.5 kg, below 2 kg, and option D below 3.5 kg. Hepatitis B vaccine is not given if the birth weight of baby is below 2 kg. Option C is correct. The next question, in which year baby friendly hospital initiative was launched? And the options, option A 1985, option B 1987, option C 1992, and option D 1999. Correct answer is option C 1992, baby friendly hospital initiative. This baby friendly hospital initiative was created and promoted by WHO and UNICEF. This is mainly to improve the infant and young children nutrition and have focused on promoting breastfeeding also. The next question, which of the following disease is also known as breakbone fever? Options, option A typhoid, option B dengue, option C hepatitis B, option D diphtheria. Breakbone fever is dengue. Option B is correct answer. And the next question, and also last question in this series, the main vector of dengue virus is option female anopheles mosquito, option B Aedes aegypti mosquito, option C rat, option D dog. Correct answer is option B Aedes aegypti mosquito is the vector of dengue virus. The reservoir of this dengue virus is man, both man and mosquito. That is, the transmission cycle is man to mosquito, mosquito to man, mosquito to man, man to mosquito. That is the transmission of cycle. And the Aedes aegypti mosquito is the main vector for transmission of this dengue fever. Here option B is correct. So far we discussed the 20 questions. So first part and second part completed. The next part we can see in the next video. Thank you for watching my channel. If it is useful, please subscribe my channel and watch more videos.